A lot of the work that we do is behind the scenes. Hospitals are like a little city. Everything you have in a city, you have in a hospital. In the last 12 months, we've completed quite a few large and complex projects that we've completed with the internal team. A PET suite at Concord. So there's a PET scanner that's been constructed there with all the supporting services. That was done earlier this year.
Each individual uptake room is here, and this is an inpatient trolley bay where patients who are from the hospital wards or other hospitals that come here will go. PET scan's very important to Concord Hospital. This is now the second PET scanner within the district, and it's able to now minimise their waiting times and also provide a PET service for the Concord Hospital district and the Concord area, and also for our hospital inpatients.
Because you're doing a nuclear facility, it's a very high radiation with the machine. It's not like an ordinary X-ray machine or a CT. We get a radiation report done, which stipulates what our design features are.
The layout of this department is very unique in the sense that radiation safety is at the top of our minds. We've heard a lot of feedback from our patients. A lot of them live in the area. It's very easy for them to commute. Some live a couple of streets away. Others have commented about the ease of the car park, which is just outside. Patients can park in the car park within 10 or 15 steps. They're within the department. They're very appreciative of the service, of how clean and how new it is, and all the modern technology that we have.
One of my proud projects is the Infusion Center. We want to make sure that we also provide the welcoming atmosphere, privacy for the patient, and make them more comfortable using the space in the generous space and design.
We started off the planning process with engaging the stakeholders, and we looked at trying to improve the space for both not only the patients but also the clinicians that work here.
So we're an infusion centre, we're based at RPA Hospital. We treat about 25 to 30 patients a day, a lot of different specialties we cover. The difference between the new centre and the old centre, there's a lot more space in the new centre. It's a bigger footprint, the patients can be safely socially distanced. We've got new recliners that go fully flat. Patients are more comfortable in those chairs. We've got 2 isolation rooms too, which we didn't have at the old centre, which enables us to treat infectious patients.
From a patient's perspective, it's great. It really is good. Lots of space, better chairs, and but the most important thing, the service hasn't changed. It actually got better. And so I think maybe that could be to do with the new environment.
Some of the other projects that we're also quite proud of is the Aboriginal cultural lounges that we've created at Concord Hospital and at Canterbury.
It's a space where, as Aboriginal people, we can have a conversation and talk about their treatment plan, give them support, whether it be accommodation, food vouchers, transport, and links to other organisations that can help them out while they're staying here for whatever treatment it may be for the patient and all the family supporting them.
This space has really improved my break time. I feel like it's a getaway from the rest of the hospital. The sunlight is wonderful, and there's enough room that even if plenty of people are in here, you can still feel like you have your own space.
While I'm sitting on the couch here, I feel like I'm away from work. I just feel relaxed.
We can teach our junior staff when they come in. We can orientate other staff members, medical students, allied health, nursing, and even the general public. And this is really a great opportunity for Canterbury Hospital to excel.
Shock delivered. Start CPR.
So this centre is really the first step of a number of steps. It's the beginning of a journey where we can do so much for our community and for training the next generation of researchers and scientists.
One of the really exciting things that we've branched out into is the 3D lab that we've created here. We're working closely with the Institute of Academic Surgery to link what we do in terms of the 3D printing, how we can translate that into actual physical components that we build. We've invested quite a bit of time and effort into creating a lab. We're very proud of what we've achieved there.
This will be the future for the design team, that we can show our user in the district like how their space is going to look like before they make the decision. Our roles and our aim is try to introduce, demonstrate, and come up with the design solution to save their time and see like what is going to happen in the completion.
It's invaluable to us to design something and deliver something that clinicians want and need, and something that's going to provide a very good service, which we're all very proud of here at Sydney Local Health District, and I think that's a very strong direction for us to head into.